Forward head is a common condition where your head is positioned with ear in front of your body's vertical midline. In normal or neutral head posture, your air line up with your shoulder and midline. Causes of forward head: too much time driving, carrying a heavy backpack, sleeping with your head too elevated, too much time at the computer. Forward head side effect can cause neck pain, unbalanced gait, and other side effects.
Round shoulder. Okay, what is round shoulder? The term of rounded shoulder is used to describe a resting shoulder position that has moved forward from the body's ideal alignment. Rounded shoulder, sometimes known as mom posture. And this is the example of round shoulder. The left side is good posture or normal posture. The right side naman is poor posture or round shoulder. And what is cause of round shoulder? Round shoulder are typically caused by poor posture, habit, muscle imbalance, and focusing too much on certain exercise, such as too much focus on chest strength while neglecting the upper back. Effects of round shoulder. The rest of rounded shoulder include the negative impact they can have on health and appearance by advertently training the body to be hunched forward over time. The muscle interpret this slump position as the natural state. This can be harmful for the body if left untreated. Ways to prevent the round shoulder. Keep your knees at 90 degrees and your feet flat on the floor. Try to keep your neck in the line with your shoulder blades and buttock, with your chin slightly down. Don't quick posture check throughout the day, especially if you spend a lot of time carrying a heavy bag, using a computer, or
Is winged scapula. It is a skeletal medical condition in which the shoulder blade protrudes from a person's back in an abnormal position. This is how it looks like. In rare conditions, it has the potential to lead to limited functional activity in the upper extremity to which it is adjacent. What causes the winged scapula? Most lesions associated with winged scapula are the results of blunt trauma due to repetitive movement as seen in athletics. The most common cause of winged scapula is paralysis of the serratus anterior muscle due to the injury of the long thoracic nerve.
What is kyphosis? Kyphosis is an exaggerated forward rounding of the back. It can occur at any age, but is most common in older women. Age-related kyphosis often due to weakness in the spinal bones that causes them to compress or crack. Kyphosis, also known as Meniere's disease, most commonly diagnosis is made in adolescents aged 12 to 17 years. Kyphosis can be prevented by being aware of your posture and by taking care of your back. You should encourage your children to avoid slouching, sit correctly, avoid carrying heavy skull bag that can pull on the back muscles. Take regular exercise to help straighten the back and keep it flexible, such as swimming, running, walking, and yoga.
What is lordosis? Lordosis is an exaggerated inward curve of the spine that typically affects the lower back, a condition called lumbar lordosis. Here's the pictures of lordosis. Left one is normal spine and the right one is lordosis. What causes lordotic posture? Poor posture is one of the most common causes of hyperlordosis. When the body is a seated position, muscles in the lumbar region can tighten too much as they try to stabilize and support the spinal column. This gradually pulls the spine out of alignment, causing increased curving of the spine. Ways to prevent lordosis. First, sit an exercise ball with your feet slightly wider than hip width apart, shoulder back and spine neutral. Second, tilt your hips and round your lower back by contracting your abdominals. Third, your hips in the opposite direction and arc your back. Fourth, repeat 10 times, alternating direction.
What is kyphoscoliosis? When we say kyphoscoliosis, it is outward curvature of the spine causing a humpback. Treatment includes physical therapy and wearing a back brace, and in some cases surgery. Surgery for kyphoscoliosis may involve inserting a metal rod in the spine and restructuring some bones, and it is usually followed by wearing a back cast and then a back brace for some time. The causes of kyphoscoliosis are certain endocrine disorder, connective tissue disorder, infection, muscular dystrophy, poliomyelitis, spina bifida, tumor. The effect of kyphoscoliosis. Severe kyphoscoliosis can put pressure on the lungs, limited physical function. Kyphoscoliosis is associated with weak back muscles and difficulty doing tasks such as walking and getting out of chairs. The spinal curvature can also make it difficult to gaze upward or drive and can cause pain when you lie down.
What is scoliosis? Scoliosis is an abnormal curvature of the spine. There is a natural forward and backward curve to the spine. With scoliosis, the spine rotates and develops a side-to-side curve. Curves may be as mild as 10 degrees or as serve as 100 degrees or more. People with scoliosis should avoid keep the neck bent forward so the head faces down, such as when using smartphones. Playing football and other high-contact sports are dangerous for people with scoliosis. Ballet and gymnastics may also injure the thoracic spine. The causes of scoliosis are certain neuromuscular conditions such as cerebral palsy or muscular dystrophy, birth defects affecting the development of the bones of the spine, injuries to or infections of the spine, and spinal cord abnormalities. The treatment for scoliosis is depending on the severity of the curve and the risk for it getting worse. Scoliosis can be treated with observation, bracing, and surgery.
What is gynobarum? Gynobarum is an exaggerated bending outward of the legs from the knees down that causes the knees to be spread apart when the feet and ankles are touching. And also, gynobarum is a Latin term used to describe bow legs. This condition may present from infancy through adulthood and has a wide variety of causes. As it becomes more severe, the patient may exhibit lateral knee thrust and a waddling gait. What is the causes of gynobarum? The most cause of gynobarum is rickets or any condition that prevents bones from forming properly. Skeletal problems, infection, and tumors can affect the growth of the leg, which can cause one leg to be bowed. Bow legs or gynobarum is a condition in which your legs curve outward at the knees and your feet and ankles touch. Infants and toddlers often have bow legs. Sometimes older kids do too. It's really serious and usually gets away without treatment, often by the time a child is 3 to 4 years old. If you have bow legs and participate in high-impact exercise such as running or aerobics, or sports such as soccer, stress on your knee joint can increase your risk for knee osteoarthritis and patellofemoral pain. What is genu-valgum? Genu-valgum is a condition in which knees tilt inward while the ankles remain spaced apart. The condition is slightly more common in girls, though boys can develop it too. Knock knees or genu-valgum are usually part of a child's normal growth and development. What is the causes of genu-valgum? Mistreated or untreated traumatic injuries cause facial damage or overgrowth. And the symptoms of genu-valgum include an obvious visual separation of the ankles when the knees are together. The individual's gait is also likely to be affected as they compensate for the lack of gap between their knees. The altered gait may cause additional symptoms such as knee pain.
What is pes planus? Pes planus is a condition in which the longitudinal arch in the foot, which runs lengthwise along the sole of the foot, has not developed normally and is lowered or flattened out. One foot or both feet may be affected. We are all not consistent on our feet. We all do not have the same feet, so our footprints and scratches are also different.